Hello, good morning. I'm Eli Diamond. I'm a neuro-oncologist at Sloan Kettering in New York. And so I treat ECD patients with all kinds of manifestations of ECD, but my training and my interest is in the brain. And so I'm going to tell you a bit about Erdheim-Chester disease and the brain. I'm going to try to do a somewhat shortened version so that we can catch up on time. And if you have questions that are sparked by what I say, we can answer them during the panel. So I'm going to tell you a bit about the way that ECD affects the brain and the spine, I would say in the more obvious and recognized ways. And then we will talk a bit about what I think are some of the neurologic effects of the disease that may be, I think, very common but less recognized. I'll tell you a little bit about some of the research that we're doing about the way that ECD affects the brain. And then I'm going to touch a little bit on principles of how ECD in the brain is treated and the challenges. Depending on how you estimate involvement of the brain, about a third or so of ECD patients have problems in the brain of some kind or near the brain that you can see with scans. The most common types of problems are those that affect balance and speech and coordination of the arms and legs. The most severe type of problem is if there's difficulty with swallowing and breathing, and that I think is probably the most life-threatening brain consequence. And then I always make a mention of the fact that I think an unappreciated symptom is that relates to when people have inappropriate laughing and crying. And that is something that unless people know that that's a common symptom of the disease, it can be something that's very distressing to patients and to families. And it's important to recognize that, and there are reasons why that happens that we can talk about, but I'm mentioning that. I'm going to talk to you a little bit later about a registry study that I have that is gathering information about symptoms that patients report. And so in this study, not a third, but really 3/4 or more of patients actually describe neurologic symptoms of some kind, regardless of what their scans show. And what I'm going to tell you is that a lot of this is not really explained by what's seen on MRI scans. And there's new research that I think is showing a bit of the footprint of what clinical scans may not demonstrate. So these are 3 very typical MRI scans of ECD tumors in the brain, and this is in the back of the brain, and this is things that would cause trouble coordination of the arms and legs and problems with speech and balance. Similar here, this is in a similar area, excuse me, and these people would have slurring of the speech and difficulty maintaining their posture. Other symptoms that can happen are headache. Dementia just means loss of function that someone had, cognitive function or other functions. Problems with bowel and bladder incontinence can happen. Various kinds of deficiencies of brain hormones. Things like problems with mood and behavior, I think, are unappreciated and are very common, particularly things like depression and anxiety. And fatigue is, I think, the most common symptom reported. And this can come from many reasons, the brain among them, and this is a very, very severe problem that ECD patients face. These are some other examples of abnormal brain MRIs. This is ECD surrounding the brain. This is ECD near the pituitary that could cause hormone problems, and this is more of a multifocal, sort of all over the place type picture. I'm going to make a quick mention of the fact that a lot of ECD patients have what we call neuropathy, which is sort of pain, tingling, numbness in the feet or the feet in the hands. I'd say this is very common, but its relationship to disease or treatment or other factors is not very well understood, but I think it's something that happens very much. This is for me to tell you that I have many patients who have, let's say, balance problems, but they don't have a tumor in their brain to explain it. And in some instances, something like a PET scan, this is a PET scan, this should be light everywhere, but this is the back of the brain that controls balance, and it's sort of dark, it's abnormal, but this is someone who had a normal brain MRI. So there may be different ways of evaluating symptoms and problems. Cognitive problems, trouble with thinking and memory, I think are very common and under-recognized, and that includes things like difficulty paying attention, remembering things, handling multiple things at once. This is something I hear very commonly, and this can affect the way that people work and function normally, and this is true even of patients who have a normal brain MRI, and so this sort of remains common and unexplained. This was a study that I did a number of years ago, and this was comparing the MRI scans of Erdheim-Chester patients to normal patients who are sort of matched for age. And the orange here is areas of the brains of Erdheim-Chester patients that are a bit smaller. Now these are not, it's not smaller to the eye. These were all normal MRIs, but this suggests that there is some loss of brain in Erdheim-Chester patients compared to normals, and then I've taken this study a bit further that I'll tell you about. So I'm doing a similar type study now, except as opposed to looking scans done in the past, we're doing them all the same way, sort of going forward. And it's very, very strict criteria in the sense that there can be really no other reason for the person in the study to have anything wrong with their brain. They've had no treatment, no surgeries, no radiation, and then no long list of medications that can affect brain function. And so these are sort of pristine, they should be pristine brains, and anyone who has a scan and their MRI is abnormal in any way is excluded from the study. So any abnormalities we find, by definition, are invisible to the eye. And the patients get cognitive testing and all kinds of fancy MRI type stuff. And this is a study that's been funded by the Global Alliance. So this is the cognitive scores, and all you need to know is that each row is a patient, and every red block is abnormal. So these are people who have no reason for any thinking or memory problems that we know about, but there are these abnormal scores across a bunch of different tests. And mainly the tests are things that relate to paying attention and to making decisions. This is a look at the white matter in the brain of the participants compared to normals. And what's blue is abnormalities in the white matter, sort of the wiring of the brain. And these are differences that the computer can detect, but that the eye doesn't see. So again, these are all normal scans to the eye, but there are abnormalities in the sort of the connecting wires of the brain. Likewise, this is the surface of the brain, sort of the overall size and volume, and there are reductions in the size of certain areas of the brain in the patients compared to normal people, and these are actually parts of the brain that would be related to attention and decision making. So it kind of all fits, although it's fascinating that to the eye these are entirely normal scans. So what we're seeing so far is that there's much more than can be seen on scans, and that I think usually the patients and families are the least surprised by this, because I think these are people, you guys are the ones who are observing these things all the time. So I'm going to go over just a few principles of treatment. I'll talk about conventional treatment, sort of chemotherapy, immunosuppression. I'll talk about those all sort of in one swoop, and then sort of the new targeted treatments and what are the ups and downs of those. So I'm probably not giving a fair summary of all of this, but what I would say overall is that when you think about chemotherapies and immune drugs, the results with treating ECD in the brain have been inconsistent. There are certainly instances and reports of very successful and very lasting treatment with things like chemotherapy or other medicines. And on the other hand, there are many examples of these medications having no effect whatsoever. And I don't think we know very well what predicts one or the other. And so I would say that there is a value for these medications, but when and in who is not entirely known. These are instances of a BRAF inhibitor, the medication that blocks mutated BRAF, being given. And what you can see here is that these tumors have gone away, almost like disappeared. And this is tumors in the bone disappearing. So the BRAF drugs work quite well in terms of getting people better and making the scans better. However, these drugs have many challenges. Lorenzo mentioned these earlier. They can be very difficult to tolerate for a variety of reasons. And so it may be tempting to stop them and see what happens, but this has been done, and what we know is if someone takes, if this is a tumor before a BRAF drug, it gets better, and then you stop it, it tends to grow back. And so you have, on the one hand, the difficult position of side effects of the medication in the long term, and then what happens if you stop on the other. So there are many people who have kind of landed on what feels like a tolerable dose of these medicines to try to hit the middle path. And I think that works for some people, although this is an instance, if you look, this white here is abnormal. So there are some instances of people who are on these very low doses to spare side effects, but sort of have a gradual worsening of their brain function, and then you can see that perhaps some of the disease is not being fully treated because these drugs don't enter the brain very well, and so when you're on a low dose, you may sort of not be fully treating all of the brain problems. And so we don't have a great answer to this, but some various strategies would be instead of taking a low dose all the time, taking a high dose on and off. I mean, I'm making this up as I go, but there's lots of different ideas and things that have worked for certain people, and it's really best planned for individuals. For patients without BRAF mutations, there's increasing evidence for using what are called the MEK inhibitors that Lorenzo mentioned. This is a very large brain lesion, and this was the way that it disappeared very nicely with a MEK inhibitor. This was a BRAF negative patient. And this is another example of this, and this is a BRAF positive patient who got a MEK inhibitor. This, as has been mentioned, this is a trial that I've been running of a MEK inhibitor in New York. And once again, another BRAF negative patient with a tumor in the brain that improves very nicely with a MEK inhibitor. One of the downsides is that this is not available to many people, and I think that the side effects are probably not as bad as the BRAF inhibitors in terms of limiting whether people can take the treatment, but there are important side effects. The drug can affect the heart, all kinds of other bothersome side effects, however, that can usually be managed. And then the MEK drugs do have some problems, eye problems and heart problems that can block continued treatment entirely, although those are uncommon. This is my neurologist perspective, but I think ECD affects the brain in one way or another for almost everyone. And the symptoms are very common, and they include things like problems with thinking and memory, fatigue, and mood. I think studies are showing that there's a lot that scans don't show, and we're trying to learn how to best use these treatments that work, but that have side effects at the same time. And that's it.